Hi everyone, Dr. Jason Cook here at Newington Medical. I'm just thought I'd do another live update with regards to coronavirus, or it's actually SARS-CoV-2, so it's a SARS virus, a SARS coronavirus, so severe acute respiratory syndrome, which is what happened in 2002. Now I'm reiterating that point because there's been debate about the severity of this particular disease and making comparisons to influenza and things like that. We have to be very clear that this virus is a very serious matter. I would just ask people to look up SARS, S-A-R-S, in 2002, 2003, and it was a freaking nightmare. Fortunately, it didn't come to Australia, but now it's here. It's here in a different sort of incarnation. It's far more infectious. It's not perhaps quite as aggressive, not quite as lethal as what the original incarnation was, but make no mistake, this is a very serious disease and it has the capacity to really decimate populations. Like we're looking at, death rates in the order of 4%, depending on, your age and risk factors and things like that. So I just want to reiterate that point, and I think it would have been better if they'd have named it SARS, just to reiterate that this is a very serious thing and it has very serious consequences. That isn't to say that we should, lose it, completely go hysterical, which is what's happening. But we definitely need to be cautious and very. We need to try and mitigate the risk as much as possible. So the way that we can mitigate risks is through this social distancing, right? Which is where we stay, or meet 1 or 2 meters away from everyone else. Use hand sanitizer if you don't have access to a sink. So preferably wash your hands, but certainly maybe keep a bottle of this. I know it's hard to get and people are going crazy. It's really not necessary. Like, these people are insane. I just cannot believe how they're behaving. It's very disappointing. Yeah, we've really seen the depths of humanity in the last sort of couple of weeks, which is really a shame. So no need to go hysterical. I have one case today where a young guy, he thought he had a fever, but it was just a hot day, and I had to reassure him that he didn't have a fever and therefore he didn't have coronavirus. So, and his employer got all anxious about it, and I just said, you don't have a fever, it's just a hot day, don't worry. So coronavirus, you get fever, definitely get fever, like something in the order of 98% of cases have fever. Coughing, maybe sore throat, you don't tend to get runny nose though. So many of these rhinoviruses are going around at the moment, runny noses and sore throats. I mean, it's the usual kind of stuff that we have to deal with anyway, and then we just have to deal with this possible risk of coronavirus on top. At the moment, we've got about 307 cases. I spoke to a microbiologist today who indicated to me that the confirmed cases are a fraction, basically, of what's most likely to be out there. Something in the order of 4 or 5 times that many could be in the community. We're not sure, but it's certainly got to be more than what confirmed case numbers are at the moment. That being said, there's no need to lose our freaking minds about this. It can be managed. People need to just calm down. The buses are still running, like the Prime Minister said. Electricity is still on, water's still running, life does go on. So there's no need for people to lose their minds. It's become this kind of snowballing effect because you have a group of people clearing out the shelves and then everyone else is like, oh, I'm going to miss out. So it's kind of this self-perpetuating problem now. But I really wish people would become a bit more rational about this. Don't know if that's possible in this day and age. There's so much misinformation out in the internet, and in the social media. So I'm trying to redress the balance a little bit here by doing these videos. So there's no need to get hysterical about things. We need. I think it's probably a good idea if we just assume everyone's got coronavirus. If we just did that and we just assumed everyone's got it and we take universal precautions, then we can arrest the spread of this pestilence. Universal precautions, basically that means you assume everyone's diseased. And in healthcare we do that anyway, actually. We're meant to do that regardless. But trying to get that across to the public can be difficult. So universal precautions means washing your hands, don't touch people, you know, be mindful of fomites, right? Things, pens and things, you know, these are called fomites. That's the technical word for it. So things can become vectors of transmission of disease. So the way you mitigate that risk is just to don't handle things that you don't have to handle, essentially, and also wipe down things that are used. So if you can get some alcohol, you know, wipes like this, or even just some alcohol wipes is good, or anything, any kind of disinfectant is better than no disinfectant. Some kind of just wiping down surfaces, wiping over things that might be vectors of transmission of disease is prudent. So people just should be mindful of that, because apparently this virus might be able to survive on surfaces for extended periods of time, and that's a bit of a frightening prospect. So I think we just need to be very cognizant of that, and just make sure we clean objects and fomites. Clean your fomites, people. One other thing that came up, new piece of information today, was that for the first time we have a private coronavirus testing facility. So here at MedLab at Auburn, they're actually running coronavirus testing between 10 and 4, like 10 a.m. to 4 p.m. Monday to Friday, and Saturday 8 to 12. So the only thing is you need to have a referral from a GP to do the test. And if you've got risk factors, so in other words, if you've got fever, if you've got coughing, if you've been exposed to the public as well, like if you work in a situation where you're exposed to the public, then that might present a risk of getting coronavirus from perhaps someone who hasn't been diagnosed. So that's important to consider, because the diagnosed cases are, we've got 307 confirmed now, but they were infected at least maybe 1 or 2 weeks ago. So we're actually, the numbers today, we're looking back 2 weeks ago, or at least a week ago. So the numbers are, they have to be higher, because that's in the past. So there are people out there undiagnosed at the moment. So we need to find these undiagnosed people so that they can be managed accordingly. So GPs can order coronavirus, it's called a PCR swab, and they can take that down to MedLab at Auburn. They've got a special setup down there between 10 and 4, Monday to Friday, and Saturday 8 to 12. So that hopefully will relieve some of the burden on the public health system. So I just thought I'd update everyone about that, because that's a significant development. And there's no particular criteria. You don't have to have been traveling overseas. You don't have to have been in contact with coronavirus case in order to get a referral from a GP, but they have to have enough clinical suspicion to order the test. So for me, that sounds like, you know, if you've got fever, coughing, you know, you work in, certainly if you work with the public, then that would expose you. You would think that logically that would expose you to more risk. So just something to think about there. Other than that, I think we just need to maintain a social distancing. I don't know how long this is going to go on for. It's a freaking nightmare. This is SARS. it's just, I don't know where we're going to go with this. I just hope that we can get it under control. The horse may have bolted. We're kind of in that, we're in we're in the precipice. If we can knock it on the head, if we can test enough people and close off the borders, which is what they've done, maybe we can knock this on the head in the next 2 to 3 weeks. If we go the way of Italy, they were around the same number only a couple of weeks ago. So God forbid it doesn't progress to that. It seems unlikely. I can only hope that the measures that have been put in place by the government will work, and that people, really, it's up to the people. You can't ask the government to do everything. The people have to actually commit to preventing the spread of this scourge, and knock it on the head as soon as possible. So that's about it for the moment. I'll endeavour to do another update in the next few days. So it's over and out. Good night.